Hello, my name's Nadine Tilbury. I'm the Policy Officer for the Working Together with Parents Network. I'm a non-practicing solicitor and my background includes local authority solicitor, private practice solicitor, litigation, family and crime in particular, and then a long stint civil service working in the family justice sector and the criminal justice sector, in particular on issues such as the criminal family system interface and child witnesses and victims and disabled witnesses and victims. So we're going to talk about substituted parenting to start with. Supported parenting or substituted parenting? What's the difference and does it matter? Well, all parents have a right to support with their parenting. But we became aware from about 2017 of an increased reference to substituted parenting rather than supported parenting. And we also noticed that in those cases, the child was being removed from its parents. So after studying quite a few of these published judgments, it became clear that where there's a supported parenting theme, the child tended to remain at home. Where it was called substituted parenting, the child was permanently removed. And it was where the local authority would say, we've identified the support necessary, but it would amount to substituted parenting, which, as we know, is harmful for children. The children must therefore be removed. Examples of those substituted parenting findings were in cases like the local authority in G, PQR, RED. Now in RED, number 3, they didn't refer to substituted parenting, but they did refer to parenting by others, which was in essence the same concept. And we started to ask ourselves, looking at these published judgments, what exactly is it, this substituted parenting? Is it the amount of support, or is it the type of support that's problematic? What is too much support? Too many people? Too many hours? For too long a time? Where is the dividing line between extensive and excessive support? And where did this term and concept even come from? What is the evidence base for it? And most of all, why were we never seeing any analysis of the perceived risk? Why were no options being explored to mitigate or even eliminate the perceived risk? And we asked around, we asked practitioners, we asked academics, social workers, lawyers, judges, and nobody really knew. It had just become a thing. We were fortunate then to get funding from the Nuffield Foundation to allow us to conduct a 2-year study into this concept. Project ran between November 21 and April 23. We interviewed social workers, lawyers, judges, independent advocates. We interviewed the parents in focus groups. We had a parents advisory board and we had a professionals advisory board. And our findings, our key findings, included the following. First of all, that the origin and the meaning of the concept were completely unclear to people. It's what they described as a shorthand, a jargon, and it seemed to crop up when the proposed support was considered to be too long, too expensive, too many professionals involved. And what we were struck by was that we were always talking about potential packages, never actual support packages, just theoretical ones. We talked about generic children and families. It was always children feel this, children do that. It was never about Mark feels this or Jenny reacts in this way. They were never specific to the family. There was talk about this wouldn't be a normal childhood. This would be an artificial environment without any further exploration of what actually people meant by a normal childhood or artificial environment. And most of all, again, no analysis of perceived risk or options to address the perceived risk. We had thought that maybe this just wasn't being mentioned in the published judgments, that maybe these arguments were being raised in writing in the statements or orally in court. After all, published judgments aren't transcripts. But all the people we interviewed confirmed that there wasn't an analysis or options to address the perceived risk. There was no cost breakdown. It was always, it will be too expensive, it will be too costly, but it never said how much. And there certainly was no cost-benefit analysis, for example, comparing the cost of support at home compared to the cost of removal, particularly if you're talking about multiple children. And there was no mindset at all for a long-term approach. The mere mention of, and this will have to be for some years, seemed to be sufficient to disqualify it as an option for a support package. You can imagine how pleased we were, therefore, to see the Court of Appeal in February 2023 saying judges need to be wary of arguments based on the concept of substituted parenting. They should carefully scrutinise the evidence adduced by the local authority that the level of support required by the parents would be on a scale that would be adverse to the child's welfare, and should look for options for ameliorating the risk of harm that might result from the high level of support. It is all encapsulated in the simple sentence in para 144 of the guidance quoted above. Every effort should be made to support and not supplant the parents. That was in Re-H. That was followed by further 2 Re-H cases regarding risk. In the Mother and Another Shropshire Council and Another, the court said, you need to balance the risk to H of removal. The risks cannot be eliminated, but that is the truth of many parenting situations. And again, a Re-H case. Para 35, court said, in my view, neither the local authority nor the guardian have thought sufficiently carefully about what the specific risk is that they are trying to protect H from by preventing her from going to Spain. At para 37, they talked about inconsistency and lack of analytical focus in the local authority's case. At para 45, challenges with communication and risk of misunderstandings, mutual struggles with trust. At para 46, they talked about any perceptions of risk could be mitigated by, and then they addressed a number of options. And there were further similar type cases, looking at meaningful analysis and gaps in evidence and risk analysis. In G, a child care order, complex developmental needs, the court said that the need for the local authority to provide meaningful analysis of appropriate and relevant detail about any proposed interventions or support. Lack of such detail or analysis in this case made it impossible for the court to conclude proceedings, despite being already in the 135th week. In a local authority VM and others, there had been a gap in the evidence in that there had been no assessment as to how risks associated with the mother could be managed. Our substituted parenting report can be found on our website, and the details are here in this slide. In essence, there's a very short executive summary that can be read. It's only a couple of pages long. It has the key findings and it has the recommendations. But the key findings were that it was always about a theoretical support package. They were never real packages tried and found to be wanting. They were never real. They were never going to be put in place. No detail was given, no analysis, no options explored. It was just a matter of saying it would be too long, too many, too much, too costly, unsustainable. We are, of course, delighted that the courts are now scrutinising the evidence that is being put forward to support a party's recommendations. Because surely this too much, too long, too little cannot be a basis on which a child is removed from its family. Thank you.